Today we will see about what is supinator jerk and what is inverse supinator jerk. In deep tendon reflexes, when we consider supinator jerk, so first we will see what is normal. Normally we have to do flexion at elbow, and the forearm should be semi-pronated forearm. Then we will give a jerk with knee hammer over the styloid process of radius, that is over the brachioradialis. So tap over styloid process, or as we name this as deep tendon reflex, so the tendon of brachioradialis. So what will be the result? There will be evident flexion of the elbow. So commonly we see flexion of elbow, and sometimes we even can see supination of forearm. So this will be the reflex, and the root value is C5, C6. So this is the normal thing about supinator jerk. But in case of inverse supinator jerk, so we will see that now. Inverse supinator jerk. Here, commonly it is seen in cervical spondylosis. So in cervical spondylosis, to consider specifically C5, C6 segment, there will be myeloradiculopathy. So there will be hyperexcitability of the motor neurons below this level. So hyperexcitability of C7, C8 we can consider. C7, C8. So now when we are doing the supinator jerk, that is flexed elbow and semi-pronated forearm, we are giving a tap over the styloid process. Now instead of flexion of elbow, there will be prominent flexion of the fingers. So prominent flexion of fingers will be the result. This is mainly because of the hyperexcitability of C7, C8. So this is called as inverse supinator jerk. We expected the flexion of elbow, but there is prominent flexion of fingers. Similar thing will apply to inverse biceps reflex. So when we see inverse biceps reflex, commonly we know that when we tap over the biceps tendon, there will be flexion of the elbow. So that is normal reflex. So again, root value is C5, C6. But when there is cervical spondylosis at this level, there will be hyperexcitability of the segments below this, that is C7, C8 will be hyperexcited. Now routinely we are giving tap over biceps tendon. Expected is what? Flexion of elbow. But in case of cervical spondylosis, the result will be extension of the elbow. Extension of elbow because of triceps contraction. So we are stimulating at C5, C6 level, but C7, C8 are in hyperexcitable state, which will lead to extension of the elbow by contraction of triceps. So this is called as inverse biceps reflex. So why these inverse reflexes are important? To localize the site of lesion. Hope you got the point.